what we can do to sometimes quiet down the heart. What's that called?
So we mentioned cardioversion, or shocking the heart, which we do sometimes. A more definitive procedure in some patients is called ablation. And we have a specialist within cardiology called an electrophysiologist, or an electrical specialist, and they do a catheter procedure where they ablate, and that sort of zap areas of the atrium that cause...
That's the upper chamber.
The upper chamber.
Is that where the problem usually starts, up in there?
It does.
How do they find the area that they need to ablate?
Right. They do mapping. So they go up and they detect where the extra beats are, and they do I call it map and zap. So they do mapping and zapping. So it's called ablation. And
so you can find areas that are hot, that are trying to trigger off irregular rhythms.
Yes.
And if they map those areas, then they can go back in, or while they're in there mapping the first time, and they can zap.
They can, in the same setting. In the same setting.
What does a zap do?
Well, it really creates scar tissue. This is where scar tissue is our friend. Right? So creating scar tissue in certain areas eliminates the ability for these electrical signals to travel through the atrium.
So the problem in atrial fib is these areas fire off, and when they fire off, you get into an irregular rhythm.
Yes.
So we're finding that area and we're zapping it to where it won't trigger off those irregular bursts of rhythm problems.
That's right. That's right.
How do people know if they've zapped the right map?
Oftentimes right there in the EP lab, once they've done that successfully,
EP lab?
Electrophysiology, kind of like the cath lab, but for electrical, for rhythms, is that they can get the heart back into normal rhythm by the end of the procedure. Other times they do ablation, and they might have to come back later and still do a cardioversion or a shock, but the combination of those will get the heart back into rhythm.